All right, welcome back. We're going into infrastructure. So this is probably one of the key pieces, and I know I keep coming back to this thing that, well, there's 7 elements, and therefore they're all key pieces. But infrastructure, it's do or die with infrastructure. You either get your infrastructure right or you don't. If you don't have the right infrastructure, it's really difficult to have any type of platform for a program. This is really sort of that foundation on which you're going to build your program. The other thing is it's also going to be a case for sustainability. Remember, you're going to identify the people, process, and technology, and particularly the people part of it. You're going to want to pay attention to what their roles are and what their skill sets are. Why? Because in order to do that, that's what's going to make a sustainable program. You're going to need a succession plan. So when you're looking at the people who are on your current committee and asking yourself, hey, what happens if they leave? Keep in mind what their role is and what their skill set is, and start looking for those other people because you want to develop them along the way and make sure that you have good succession planning in place as you start your program. Start it on day one. It's amazing how many times people will wait until somebody leaves or quits or gets fired or something. The next thing you know, they're like scrambling around trying to figure out how they're going to replace this person. This isn't about replacement. This is about succession planning. And so infrastructure is so key for that. It also gives you a sense of what the resources are out there that you're going to need and what you're going to need to build on. And so we'll go into each of the components of it. But I just wanted to give you that heads up at the front end of this because it's really important for the sustainability of your program to make sure your infrastructure is done right. So what exactly is infrastructure? It's the foundation on which any program will be built. It refers to all the people, process, technology, and cultural elements that are required for the successful implementation, management, and sustainability of a program. The specific elements, as you'll see, are categorized by people, process, technology, and culture. And it's just a way that I use to categorize them. But I also began to realize that it's a nice way to be able to sort of sort them and begin to say, how are we going to approach each one of these categories, and then where are we going to identify either the people, the process, the technology, and the culture. So the people, and I'd like you to mentally underline the people. You can't do this without people. I mean, there's just no way. Even though all the focus is on the technology, it's the people who are going to help you get the program to where it needs to go. And so I'm going to just give you a list of what I think are the important people to have on your committee. They are must people in terms of the program. It's difficult for this program to be successful without this group of folks. And so right at the start, physician lead. It's almost impossible without a physician lead, and you need a physician who's actively in the practice of robotics. And as I mentioned earlier, I helped start up our oversight committee for the system. I wasn't involved in robotics in the sense that I wasn't actively doing it, but each of our physician leads at our facilities were. They had to be. They were the most engaged in it, so it made sense for them to be involved in it. The other thing is a physician lead is someone who people are going to go to. They're going to want advice. They're going to want to talk to them about things. Not only are they going to be a problem solver, but they're going to be somebody who someone can go to and say, hey, I need some help with this particular technique. I've been trying to do this. I haven't been able to have any luck. I know you've been able to do it. Can you show me how? And it's really nice to be able to have that type of person who's respected and who has the technical skill to be able to lead others in the operating room as well. I do think that, and I've said this before, I think a dyad structure for this committee is probably the most effective. I prefer to have a nursing lead, and particularly somebody who's involved in peri-op. If you have a robotics coordinator, that's a great person to have as your nursing lead or co-lead of this group. I think that a co-lead structure is probably going to end up being more effective for you. Now, that's difficult to do, and we'll talk when we get to governance. It's difficult to do in a medical staff model, but I think at least in spirit, you have to have the people who are going to be involved in this on a regular basis, involved and sitting in that room. And so having someone who's going to be the nursing lead is going to be important. I do believe there really needs to be an administrative representative. And do not count your nursing lead as your administrative representative. There's a lot of times people will say, well, they work for the hospital, they're administration. No, they're not. You really want somebody from administration, particularly somebody who has management and has control of budgets, because those are the individuals who are going to be able to help shape your program, at least on the resources side. There are going to be resources you're going to need at times, and you want to be able to have somebody you can go to, or at least somebody who has access to higher level management or even the C-suite when need be. You want that person to be able to go to them and say, hey, this group really needs this resource, and let's make sure we can allocate the funds for it, or whatever. Typically, we're not asking for extra money for a lot of this program. Like I said, I've been able to build programs pretty much with existing infrastructure, meaning we already had the resources. It's just a matter of coordinating them and putting them into a meaningful whole, like I'm doing here with the 7 pillars, and that is having a structure for them to operate and function out of is really important. But having the right people in the right place is also important, and particularly those that have the skill set. Administrative rep, it's nice to have somebody who's interested in robotics, somebody who maybe even has had a hand in purchasing your robot. They have a vested interest in seeing it be successful, and so those are the types of people you want as your administrative rep. I kind of went back and forth on anesthesia representative, and I heard some feedback from people out there saying that there were just going to be times when they really needed to have anesthesia in the room in certain types of discussions. Anytime you're talking about a care process that impacts things that are happening in the operating room, you just have to have your anesthesia representative available for consultation on this. And I think it's nice to just say, hey, we're going to invite you and have you as a member of our committee. You seem to be doing a lot of our robotic-assisted cases, and therefore we think it'd be beneficial for us to have your input. Particularly also when you're talking about room configuration, if you're going to be changing things around, the anesthesiologists have to have a say in it. They know those rooms, they understand the equipment. In particular, they're going to know how things need to be situated for positioning patients and stuff like that, because that's what they do. I mean, that's a big part of their job, is making sure the patient is safely secured and is being taken care of, physiological needs are being taken care of. So you want to be able to have their input in this discussion. Multidisciplinary representatives, and it's just going to vary by facility. You may be at a facility where it's only one specialty that's using the robot, so you're really not going to have a lot of multidisciplinary representation. You may be at another facility that has 5 different specialties represented, and you want to find somebody who's going to be a leader for that group, who's going to communicate to the rest of the group. I don't think it's necessary to have everybody who does robotics on your committee. In fact, actually, we found at one of our facilities that was a problem. They decided to have everybody involved, and as it turned out, majority of people doing cases there were gynecologists, and it really kind of alienated the general surgeons who wanted to have a bigger say in the robotics program. They didn't feel like they were represented. They were constantly sort of being voted out of the room, so to speak, and it turned out it was really more of a gynecology meeting rather than a true robotics committee meeting. Don't let this happen to you. It creates a lot of problems in your program, and you can avoid it by purely having representatives and people who are going back and speaking for their groups and communicating with them. Data analyst, I love data. I've told you that before. I think data is important for this type of program. You have to get data. You have to be able to see what's happening in your program. You have to know things like volumes. You have to know things like utilization. You have to know what's happening with the quality outcomes. I just think it's essential for doing it. Having a person who's very good at pulling data out, analyzing that data for you, and presenting it to the leadership is going to be key. Now, in some committees, I found myself, I was the person who was the analyst, and I had people who were abstracting data for me, and I became the analyst, and in some cases, I would be doing the statistical analysis on it as well. But not everybody has that interest or that skill set, and so it's better to find the people who have it. And so there's data abstraction, there's data analysis, and then there's data interpretation. Leadership should be the one who's really helping you, should be the ones in the, also the multidisciplinary representatives helping you to interpret data. But I do think that you're probably going to find that it's going to be pretty much unusual for a physician to be doing the data abstraction piece of it. They might do the analytics part of it, but more often than not, you're going to have somebody else doing that. Find somebody who's good at it. Find somebody who understands your database. Not only that, but get them into a standardized way of pulling the data and the type of data that you want. And you'll see when I talk about data later on, I'm not a big believer in pulling tons of data. I think you can get very specific data points, and I like to think of it as actionable data points. When you have actionable data points, you're going to be more likely to be impactful than if you just have a lot of data. They call that the drip syndrome, data rich, information poor. Don't let that happen to you. Don't get overwhelmed by data. Data can create a lot of noise in your system, and you want to really avoid that. Administrative assistant, and I've kind of alluded to this before as well. I think having an administrative assistant is critical for a program. There's so much stuff that's going on, and particularly one who has experience organizing physician events. Why? Because that person is really going to be the person who's going to be holding these meetings together and making them available. And they're the ones who are going to putting the agendas together. They're the ones who are going to be coordinating all these things. There's a lot of stuff that they're doing, a lot of logistical work. If you find yourself doing that as a physician or as a nursing lead, you're probably going to get burnt out on it. You really, it's not something that you do well, or maybe you do, but you're probably not going to want to do it. Find somebody who does this for a living. They know all the tricks of the trade, and they can get stuff done very, very quickly and efficiently. That's the kind of person you want. Remember, we're not talking about somebody who's a full-time person in terms of that's only what they do. We're talking about somebody who's going to devote a few hours a month to developing the program, making sure that all the logistics are in place and the program's smooth and efficient. That's not a lot to ask from your administration. So I think you should be able to approach them and say, hey, listen, give me an administrative assistant, somebody who's going to be dedicated to doing this, and somebody who's also motivated to do it too. You want them to have an interest in the robotics program as well. And it's nice to have somebody who already thinks robotics is pretty cool and therefore wants to be part of the team. Process. I talked about this regular meetings thing. Remember, these are things that you're going to be doing that are going to promoting engagement or avoiding disengagement. Regular meetings is a way to avoid disengagement and promote engagement. Agenda, meeting minutes, part of the communication to your committee, and to pieces of that will go to your C-suite and medical staff. So you really do want to make sure that these things are in order. It's going to be really important for your program. It's kind of the nuts and bolts. I always think of the infrastructure as the boring part of all this. Nobody really wants to do it, but it's necessary work. If you don't do it, you can find yourself scratching your head going, why didn't this program work out? And when the infrastructure was completely ignored and wasn't maintained, and that's what happens. Established reporting structure. We'll get into this when we talk about governance. And established reporting structure is really about who you're going to report to. Every organization has a governance structure. If you think you're going to lone wolf this one, don't. We've had places that tried to do that, and it doesn't work. They go out and try to have their own committee meeting, and they sit in a room, and then they talk about things, but nothing ever gets done because they're not part of the governance structure. They have no way of communicating both to their medical staff leadership and to their administrative leadership. So nothing gets done. And they get frustrated, and then they say, see, we tried it and it doesn't work. No, wrong. If you're not part of that governance structure, you're probably not going to get a whole lot done. A communication plan. A communication is some form of plan that has to be in place for all of your stakeholders. They need to know that you're going to be communicating to them on a regular basis about what you're doing. Don't think this is not important. This is extremely important. You want to have a regular way of doing that, and you want to have communication that's consistent across your entire stakeholder community. Data review, and I'm a big believer in pick your data points. Pick the ones that you really, really want to follow. Standardize it, even if it's for a quarter, more likely for a year. Follow those data points over that time period and make sure they're actionable data points, things that you're going to act on and put in processes in place to change if they're not doing so well. But pick something and stick with it. The other thing, too, is remember, if you have a data analyst, this is not going to be a full-time person for this isn't going to be their only job is working for the robotics committee. So what you want them to be able to do is to be able to pull together your data in a standardized fashion. It's amazing how many of these folks, they're pretty sophisticated. They just develop macros for their for downloading this information. And then when you call them up and say, hey, I need the fourth quarter results for our robotics committee, and they go, okay. Next thing you know, 30 minutes later, it's in your hands. Now there may not be a whole lot of analytics put behind it. Maybe they just pulled the data, but at least they can get you data that fast. If you want more analytical input, then you have to really kind of coordinate with somebody who's used to doing that. Do not have somebody who doesn't know how to do that. Very frustrating. I've had that happen to me a few times, and I just finally just took it over because I was so frustrated with it. I just said, look, I can't have somebody who doesn't understand what we're trying to accomplish. We really are trying to make sense of whether we're moving in the right direction. If you don't have somebody who knows how to either put that up onto a chart or build it into some way of communicating, they're not going to be very helpful. And if they can't assess that over time, it's going to create problems for your program. But you got to find somebody who knows how to do it. Goal setting. I can't emphasize this enough. I'm amazed at how many people don't set goals. They have meetings, they go there, they sit there, and and I just say, why are you doing this? Oh, because we think we've got a program, so therefore we have to talk about the program. I'm like, what's your goals? Oh, well, we want to be better. It's like, well, how do you establish that? How do you monitor that? Oh, I don't know. I guess, we'll know when we know. And it's like, no, you got to have goals. I'm at that point in my life where, the light at the end of the tunnel is getting bigger than the light at the beginning of the tunnel. Life is too short. I cannot sit in another meeting where we're just sitting there kind of chewing the fat and kind of going, oh, well, I think we're doing better. It's like, no, I know there's a better way. Set goals, develop processes to move yourself towards those goals, and enjoy it. Enjoy that process of improving care, getting better outcomes, making patients get better, making surgeons get better, making the hospital be a better place to work. There's nothing wrong with that. That's how we should approach every single day. And like I said, as my days get shorter, or my total days get shorter, I'm all about, let's get it done. I don't need this. Let's think about it some more. I've thought about it too many years, and I've sat in too many meetings, and we didn't get a whole lot done. Get stuff done. If you're listening to this program, if you get anything away, take anything away from it, get stuff done. Improve care. That's why we're here. Don't pussyfoot around on this one. The last one is credentials and privileges. And just a very brief story. We first developed our oversight committee, and that was the first thing we tackled. In fact, actually, that was why we were put together. We had our administration and senior management, and everybody was harping on, we got to figure out credentials and privileges for robotics, and we got to standardize it across the system. And we met for 18 months. And that was the only thing we talked about. We got nothing done. It was just a non-starter as a first discussion point. And so we tried to create this committee that was going to address that along with other things, but we never got onto the second agenda item. That was the only agenda item. We looked at papers, we looked at what other programs were doing, we got input from multiple parties. I mean, everybody was putting something in on this, and we ultimately just never got there. And there's a lot of different reasons why that happened, but part of it was I think we were bringing together a group and starting on probably one of the most difficult things you can tackle. Ultimately, you're going to have to tackle that one. Ultimately, that's going to be part of your agenda. And the reason is because if you want any credibility with your medical staffs, they want to be able to look at you as the subject matter expert. And so when it comes to credentials and privileges, you want to be able to be there and say, we have a proven track record. Trust us. We'll put together a credentials and privileges program for your facility or for your system. That's what I would suggest. But don't do it. Don't make it your first agenda. Don't say this is because your first thing you're going to do, because you can spend a lot of time. And like I said, I spent 18 months of my life and working on that one, and it was a no-go, and it wasn't really going to get us where we needed to go. We actually ended up collapsing that committee and then restarted a new committee, a new robotics oversight committee, and started with much simpler agenda items to begin with in order to get the momentum to really develop that committee and have a say in terms of what was happening with robotics for the organization, and be that place that the senior management team could turn to for advice. And I think that's really a better way to go about doing it. Technology. I talk about robot and case mix alignment, and what I mean by that is make sure you've got the right equipment. I see this a lot where people will go out and they'll say, well, I think we need a certain type of robot or something, or a certain type of technology, and you go, but is that aligning with your case mix that you currently have and the case mix that you would like to have? Meaning you've made a strategic decision to go into certain markets, and is the robot you have really the one that's going to support your market plan? And if it isn't, then you really have to start thinking about getting the right technology in there, and it's not always aligned. And I think what's going to happen is as Intuitive began to broaden their portfolio, from they started with the standard, and then the S, and then the SI, and then the SIE, and then the XI. They were dropping some parts of their portfolio, but really kind of developing other parts. And we began to realize that there really is this thing as robot and case mix alignment. There's certain cases that probably are better done in certain types of robots. And I think as we move along and other vendors start to get into this robotics space, I think we're going to see more and more of that, and that is we're going to have to figure out what robots are the best robots for certain types of cases, and make sure you have either the technology or the alignment of the case mix ready to meet with the technology you currently have. I'm also a big believer in electronic medical record. This is probably like old news now, but the nice thing about it is you can pull data off of it. You can get some data, depending on the type of EMR you have. You can get some pretty good data in terms of metrics you might have for your OR. Things like turnover time and case time and things like that. So it's a nice place to be able to get data out of. Also, if you're doing that, you probably want some type of software, some software company that's providing risk adjustment and benchmarking capability. We use Premier. It's the one I'm familiar with, but there's plenty of companies out there that do this. You want somebody who has a proven risk adjustment formula. Remember, all this stuff, not all of it, but much of it is going to be based on administrative data. Unless you're getting something out of, say, NISQIP, which is a clinical database, you're probably going to be more likely dependent on an administrative database for this. Nothing wrong with that. You just need to know what kind of data you're looking at. I think administrative data, particularly when it's risk adjusted and benchmarked, gives you directional information, and you should use that directional information. I think when you start getting down to specifics, though, it gets a little loose, and I become less and less enamored with the fine detail of administrative databases. But I do think they give pretty good directional information, so you should certainly use that. I talked about the centralized storage for documents. Either it's a SharePoint or a Dropbox or something, but have some place where your members can go and grab documents and look at them on an as-needed basis. Nothing more frustrating than being on vacation and someone sending you a text and saying, "Hey, you need to look at blah blah," but you have no way to access it. It's like, well, can you send me a copy? No, I can't. It's like, great, I left it back on my my hard drive at home. Nice place. You just click on it, you go in, and you can look at it and answer questions and be informed about what's happening with your program. I also am a big believer in teleconferencing capability. And teleconferencing can be as simple as a phone. A phone that everybody has a speaker phone and everybody can hear. I've done that before, where I just pulled out my phone and just hooked it up to speaker phone and just said, "Okay, you're now on speaker phone. Speak." And that's the easiest low tech way to do it. There are some more high tech ways, particularly if you have like I said, like a WebEx or webinar type of software that allows you to project things on the internet so people can get on their computers at home. Last thing you need to do is force people to drive across town, usually during rush hour traffic or at the beginning of the day or something like that, when they really don't want to have to necessarily make that trip. And so again, promoting engagement. Teleconferencing is a great way to do it. I could participate in the meeting and I don't have to drive across town. And if it's crummy weather out, I don't have to go out in that weather. I just have to pick up the phone or just dial in through my computer, and guess what? I'm there. And that's really pretty nice. I think that's a great thing that we have in terms of technology nowadays. You should use it if you have access to it. If you don't have access to it, there are some relatively inexpensive ways to do that. So it's just something to think about for your program. Culture. You don't have to have all these things, but it helps if you do. Quality improvement program, just about everybody has some sort of QI program at their hospital. But I'm not just talking about a quality improvement program. I'm talking about this quality improvement. Did they get involved in robotics issues? Meaning, are they doing anything for your program? Do they have any projects in the pipeline? If they don't, that's to your disadvantage. You want to get them involved. They have the subject matter expertise for quality improvement. You should get them involved in it. It doesn't matter. It doesn't have to be a big project. It'd be something pretty simple. We just want to, we're going to look at docking time. Can you help us, pull the data, run some statistics on it, and show us, who's getting best performance? Something as simple as that. There's nothing wrong with it. I think that's a nice way to start things out. It's pretty straightforward. The data is pretty solid, and it's something that they do. Particularly if you get anybody in here who's like really into Six Sigma or something like that. It's a lot of fun for them because they get to play with some data, and they look at, wow, nobody's ever approached us before and said, hey, can you help us with our program and improve things? They're usually going out and trying to almost like force their quality improvement stuff on them. And they're also, remember, they're also doing a lot of things from compliance and regulatory, which is, It needs to be done, but they sometimes get bored with that stuff, and they like to do stuff that they can really sink their teeth into. So don't knock on their door. I mean, it's amazing what you'll find. They'll open it and say, "Yeah, we'd love to help you guys." They're usually there, so just ask them. Epicenter, Center of Excellence. Again, you don't have to have it, but usually when you see that, it tells me that somebody is doing something different. Somebody wants to distinguish themselves. And I don't just mean that they're going to put some plaque up in the front lobby of their hospital, but they're really trying to do something that's going to make their program different. It's another step. It doesn't necessarily mean that they're a great program, but it means that at least they're interested and they have a culture of getting interested in developing improvements. So I like to see that. Quality awards, it's the same thing. It's just basically if you start seeing quality awards for a hospital, there's probably somebody in that culture that's working on this. And so look for those people, because if they're getting quality awards for non-robotic types of cases or non-robotic types of areas, then get them involved in your program. Like I said, use the existing infrastructure. These are subject matter experts in your own hospital and your healthcare system. They're there. And they're usually very willing to get involved in these things. It's really kind of interesting. So ask them. And I also think, this robotic supportive environment is key. So why is it so important? And what do I mean by that? First off, robotics, if you go to your department surgery meeting and your department chair is sitting there and saying, over my dead body, we will never have another robot in this hospital, and you're thinking, okay, that's what I would call not a supportive environment. If you go to your C-suite and you say, hey, we're thinking about, we want to add some new type of technology to the existing one with our current robot, and they look at you and go, no more, that's it, we're done. It's just not really a supportive environment. On the other hand, if your department chair and other people, the members, have a place for you at the department meeting, and they expect, say, a quarterly report from you, and your C-suite's scheduling you and saying, we want to hear back what's going on with the program, you probably have a robotic supportive environment. And that's the advantage. It's when I talk about culture, that's what I really mean. Look for that in your own organization. When it's not there, try to figure out ways to cultivate that. How do you get people to at least become somewhat supportive of your program? And if they're not supportive of the entire program, see if they can support parts of your program. If you say, hey, I know the OR is trying to work on reducing turnover time, and we would like to get involved in that. We would like to get our room, the turnover time, down to something better than what the rest of the OR has already set as a goal. You're going to get a lot more buy-in with that one, because you're now starting to look at, you're trying to help them improve their scores on other things, and that's the way to get buy-in from people is work with what they're already trying to accomplish. Remember, we talked about that with engagement. Find out what they're engaged in and try to see what you can do to help them with what they're engaged in. They're more likely to help you with your program and developing your culture towards that. So again, redundant, but if you have any questions, feel free to contact me. Happy to hear from you, and I'll get back to you as soon as I can. And please continue to enjoy this program. And thank you very much. You have a great day.